Good morning. This is our second lecture of bone and joint pathology. Good morning. In this lecture, we will study various types of osteomyelitis regarding definition, classification, pathogenesis, clinical picture, radiology, and possible complication of each type. Here is the definition of osteomyelitis. It is inflammation of bone and marrow. Osteomyelitis is classified into three types: acute, subacute, and chronic. The acute one may be due to a hematogenous root, as the bacteria reach the bone from a distant septic focus, or non-hematogenous root, as the bacteria reach the bone from a nearby infection, open fracture, or surgical operation with sepsis. The subacute form, the most important example is the Brodies abscess. The chronic osteomyelitis, there are two major types: non-specific type, which is a complication of the acute, and the specific type due to TB infection. Osteomyelitis is the inflammation of bone and bone marrow. The commonest organism causing that lesion is Staphylococcus aureus, but in neonates it is the E. coli and Streptococci, and in sickle cell anemia patient it is the Salmonella. Route of infection, it may come via bloodstream or extension from adjacent joint or direct traumatic implantation. Acute hematogenous osteomyelitis predisposing factors: age from 3 to 10 usually, affecting boys more than females, after trauma and formation of a hematoma. The femur and humerus are the most common bones affected, specifically at the site of metaphysis, because it has a slow blood circulation and more liable to trauma. Good morning. When the bacteria enters to the bone, it will invite neutrophilic inflammation, forming microabscesses that will spread downward to the bone marrow and radially to the periosteum. Good morning. This is our second lecture of bone and joint. When the bacteria reach the periosteum, it will lead to subperiosteal abscess formation. It will disturb the blood supply, causing ischemia, and it may spread to the soft tissue, causing abscess and sinus formation. It can affect the epiphysis in the children, leading to suppurative arthritis, and the chronicity will lead to formation of osteoclastic bone resorption and bone formation at the birth. Good morning. Here is a jar showing acute osteomyelitis with the bone marrow replaced by the suppurative oxidate. Under the microscope, we can see that the bone marrow is replaced by neutrophils, and the bone trabeculae is necrosed, denoted by absence of osteocytes. The clinical picture of acute osteomyelitis includes systemic manifestations, local manifestations, and radiologic findings which are evident after 1 week or more, including periosteal thickening, lytic lesions, and endosteal scalloping as a result of the severe inflammation. Here are radiographs showing on the left side normal tibia and fibula, and on the right side the changes seen in acute osteomyelitis, including periosteal thickening, lytic lesions, and endosteal scalloping. Good morning. Complications of acute hematogenous osteomyelitis. First of all is the chronic osteomyelitis, leading to all known complication of amyloidosis, squamous cell carcinoma. It may lead also to pathological fracture, septic arthritis, septicemia, and pyemia. Good morning. Sometimes the joint exhibits spread of osteomyelitis or the infection into inside it, in certain cases only, when actually it occurs when there is an intra-articular metaphysis, meaning that the metaphysis of the bone is present inside the joint. This is encountered in the hip joint. Another example is the presence of a long tendon passing into the joint. This example is found in the shoulder joint. So when the humerus is affected by osteomyelitis, the infection may spread to the shoulder joint. Good morning. On the other hand, Brodies abscess or subacute osteomyelitis, it is a small, localized intraosseous abscess frequently involve the cortex and walled off by reactive bone. Here it is remarked by the red circle. It is localized within metaphysis mainly at the upper end of tibia and lower end of femur. Chronic non-specific osteomyelitis, it occurs as a sequel of acute infection due to delayed diagnosis, low immunity, or too brief course of antibiotic therapy. In chronic osteomyelitis, there are three terms we should know. The first term is cloaca. Cloaca means a cavity with multiple sinus formation. Inside the cavity, we will find a necrotic bone called sequestrum. On the periphery of the bone, there is a new bone formation which is irregular. This is called involucrum. Good morning. Under the microscope, we will find the bone trabeculae with a chronic inflammation and fibrosis. Good morning. With radiology, the red arrow points to the cloaca, the blue arrows points to the involucrum, and the yellow arrow points to the sequestrum. These are the complications of chronic osteomyelitis. Tuberculous osteomyelitis is always secondary tuberculosis. The infection spread from pulmonary TB via bloodstream to the bone. Usually the long bones or vertebrae are affected. Usually it is solitary but may be multifocal in immune-compromised patients. The vertebral column affected usually is the lower dorsal and upper lumbar, maybe the vertebrae of the cervical region may be affected. The site of affection is the bone and the disc. Under the microscope, we will find the TB granuloma with evident epithelioid cells and Langerhans giant cells. Good morning. This is a jaw specimen showing on the left side Pott's disease of spine with destruction of the vertebral bodies and intervertebral disc with multiple cavities and caseation necrosis. On the right side, this is a TB affecting the ribs. Here is an Egyptian mummy with a Pott's disease of the spine. Good morning. Here are, in this slide, some complications of the Pott's disease. Good morning. Good morning.